So stem cells, that's definitely a buzzword and a lot of people ask us about it. In what kind of situations or procedures do you use stem cells?
The stem cell is still not very clearly in clinical to be used and then produce a very drastic result, something like that. So there is we just have a conference. This is first 8 times already for FAT. It's been forum for autologous tissue and stem cell in Bangkok here. And there is the number one in the world coming to join the meeting, and he's still in his hand. The percentage of, like, let's say for the breast augmentation is only just 10% more than just pure fat. But because we know more about the pure fat, pure fat right now, a portion of fat in the upper portion and the lower portion, when we do centrifuge, we see that there is also more stem cell in the fat already. So we couldn't say that the stem cell doesn't produce any effect. But because of in the fat, when we harvest, we also having the growth factor. The growth factor which enhance the vascular supply to the graft is vascular growth factor. So in all together, they will help to maintain the result even better. So it should be not drastically, so much, but at least in terms of maintenance is better clinically.
Okay.
Yeah.
So it's not a drastic difference, but it's helpful with maintaining the fat and the survival of the fat.
And there is a paper from Korea talking about using only just stem cell to inject into the tip of the nose where there is contract. It means that after the operation and there is some complication and there is contracted nose, the tip of the nose. So they don't know how to make it suffer in order to get the operation. They inject stem cell alone and make the tip of the nose softer. So I have come back and I have done with stem cell injection to the tip of the nose for few cases. It makes the tip skin become softer, and finally the patient can reoperate with good result.
Very interesting. It's good to know. Are there different kinds or grades of stem cells you can use, or is it just stem cells a blanket term?
Oh, we use fresh tissue. So I normally get the stem cell from the fat, which there is abundant. We used to have one of the doctors who stem cell doctor, and he come he want to prove that the stem cell in the fat is so abundant. He come for the 6-pack, and then he asked me to correct the fat to have a separate stem cell, and he have a look. Oh, there's so a lot. He said that is the amount is much more than harvesting from other area.
Okay. So fat transfer, that's another hot topic and definitely one of our fastest growing requests. What do you do when someone asks for a large volume of fat to be transferred? Like they want that Kim Kardashian look, the really big butt.
Right now, for the breast, we talk to many experienced surgeons, and in the past, they just inject the fat. The maximum amount they can put in, like the breast or anything. But I think that it is all related to recipient.
Okay.
So when you put the fat, it should be laying on the vascular tissue, like in the muscle, under the muscle, over the muscle, and a few in certain area, and not let the fat go to press the fat into one area like a big volume. So it means that the blood supply to the fat will not be enough to nourish all the volume there. So it means that you have to put the fat in scatter in different level until it fill up the space. So it means that for the breast, normally the maximum for me, I think it should be around 250 to 300.
Okay.
And then you will increase 1 cup size.
Yeah.
But more than that, we don't recommend, because when you inject more in one area, it doesn't take, and also it might create the infection, or it become the lipolysis in that area and become a lump or something like that.
So the amount isn't always the most important, it's where you place it and how you disperse it.
Yes. The recipient area, we have to adjust whether it is vascular line, the muscular, for the face, we put on the face, we have to put in vascular line area, and sometimes we inject Botox first. But in the large volume lipo filling, fat transfer, normally is only for the breast and the butt. But the butt, we have to be very careful, because right now the butt there is several who die from embolism. So because they inject into the muscle, and the fat go into the venous system and they embolize into the lung. So we just very, very careful to put the fat very superficial, very lateral, not the medial, because the butterfly is on the medial side, and we use to put the fat in a retrograde position, and also not a big volume into the muscle. It should be above the muscle, and also something like that. So it doesn't mean that we put as big as we have been seen before, but I think it should be with caution.
Absolutely.
And for the buttock, is sometimes post-operative care is very important.
Who is a good candidate for a fat transfer, whether it's for butt or breast? Who's a good candidate?
Just normally for those who come to see me, it's just moderate size patient, and who don't want to put the implant, because the implant, the longer you put, the complication will be like a dozen like that. You can palpability, rippling, and displacement, or some other things, and even the implant can cause some of the tumor, something like that.
Do people ever ask for an implant and fat transfer? Or is it always one or the other?
In fact, it can be either implant alone or fat alone. Someone from a certain country where they don't want to use implant, like Muslim country, they also ask for the fat. But someone, let's say you can put both together, what we call hybrid operation.
Okay.
Hybrid operation is mean that a certain amount of, you put a small implant, then the small implant doesn't cost any, you put it under the muscle, and above there you put the fat. So it's what's called hybrid augmentation.
Okay.
So
how long for the final results with fat transfers, and is it permanent?
Fat transfer, normally we probably talking about 5 to 10 years, but I would rather think that normally we have seen longer lasting result, like 10-year results, more than that, something like that.
Okay. And then how long, do you see results right away? So if someone does a fat transfer, do you see immediate results, or does it take some time?
You see immediate result first, and after that there will be like some of it was doesn't stay. So it may, we can say that it should be around 60%. So it means that if you put around 300, the remaining is around 150 or 180, something like that. So it's 1 cup size.
Is there a difference in survival rates when you're transferring fat to the breast versus the butt, or is it about the same?
About the same.
Okay. All right. you.